So very good afternoon to everyone. I hope you all can hear me.
Yes, we can hear you.
Yes. So I'll be demonstrating the iHands lens with the Signature Pro machine. We have already got the femto done. It was a great job by Dr. Chetan earlier. And that's the beauty about live surgery, is it is unpredictable. It keeps you at the edge of your seats. And he managed it really well. I think so we should all laud that you have to have the presence of mind while doing surgery. So I'm Dr. Savio, the senior consultant in Nethradhama, Phaco refractive department, and I'll be doing the iHands lens, which is enhanced monofocal lens. I'll also be using the Signature Pro machine. I know you're all hypoglycemic, and this one surgery is keeping you away from your lunch, but please bear with me. Straight nodi. So I like to make two side ports because I always use a bimanual irrigation aspiration. I make my biplanar main port incision hydro. I use adrenaline for my hydration when I'm using my femto cataract. Because of the prostaglandin release, you can have some amount of meiosis that comes up. And this is a relatively more softer cataract. You can see the air bubble from the femto, and yeah. So you also have something like a pneumodissection which does occur because of the femto, and you can see the air bubble there, you can see the lens rotating. Now, since you have a relatively softer cataract, you don't really need the lens softening here. Just getting the capsule out, you can see we've got a nice free floating capsule over here. So I'm using a 20 gauge straight tip. Okay. Okay. And you already have pre cuts over here. So these, since it's a soft cataract, you just need to go in and separate it. You don't need much of power. And if you see, I'm using the blunt side of the chopper to actually separate it because it's quite a soft cataract. I don't want the tip to go down because it's quite soft. Yes, I would have used the tip. You got your nice 4 quadrants. You just want to go separate it. And once you have your 4 quadrants, you can just go pick up each wedge, bring it up. I use a ramp of 60 and my settings are 4400. So yes, you have very good magnetic fallibility with these. And so yes, one thing you need to remember that whenever you're doing the femto, you don't get this anterior frill of cortex which you love to catch, which you get with a regular, this, yeah, machine salpamunde, salpamunde, yeah, okay, and yeah, cortex, yeah. So you have to catch the edge, which is actually flush sometimes with the capsule. You need to be a little careful over there. So always I follow the rule that you change your hands. You finish off half and then you can just switch over. Yeah. You can see a little conjunctival ballooning which is occurring here. That's because I've nicked the conjunctiva there, but that's fine as long as you finish your case before. And here is the hydropolish to just clear up all the residual fibers. Just put your viscoelastic. Now, this is the eye-hands lens which I'm using, which is an enhanced monofocal lens. Kanali ಸ್ವಲ್ಪ pressure ಇರುತ್ತೆ. Okay. Yeah. So what I like to do is keep the irrigation on and just let the visco come out, do a thorough visco wash all around. It's very important to see that the visco from behind the lens also comes out, and also that the lens opens up well. As you can see, being hydrophobic, the beauty about this lens, it gives you about a 1.5 ad. To remove the visco more quickly, you can just go in from the main wound, because then it just flows out, and you can just go behind the lens gently and you can remove the viscoelastic. This is one of the techniques which you can do, or you can do your rock and roll technique by just tapping the lens all over, and there you have most of your viscoelastic out. So this is a method where you can just use the main port leakage to actually wash your visco much more faster. You can see if your wounds are well constructed, the EC doesn't collapse, the patient can look straight, you can just hydrate one of the side ports. It's well formed, there's no movement of these particles here, and that's done. Light ಕಾಣಿಸ್ತಾ ಇದೆ? So light ಕಾಣಿಸ್ತಾ ಇದೆ sir? 3 light ಕಾಣಿಸ್ತಾ ಇದೆ? Yeah, there was a fiber there, just wash that, and yeah. Operation's all done. So we just want to tell that we have a very, very interesting session coming up next post-lunch, and that will be the complicated cases. And I always like to check with the speculum once I remove, and so you can see you have a nice clear cornea and a well-centered lens. So thank you very much.
Thank you. Excellent surgery.
Yes. So the Signature Pro machine which I was using, I use an aspiration of 38 and 450 and 4400 with a ramp of 60. That gives me a very fast magnetic fallibility, and the pieces just come to you. So that's what I really like about it. This machine is the foot pedal, which gives you a lot of splay, while most of the machines, the 1, 2, and 3 is very rapid change. This gives you a much more greater amount of change, and it's all in the foot pedal, I would say. Yes, sir.
I think it's all in the surgeon. Great surgery.
Thank you so much. Thank you. We learn from the best. Yeah.